what happened when you go to the dentist, you have no pain, no symptoms, and it says you have external root resorption. And you notice just a little bit something here that it was bothering you. The patient said, I will put my nail and try to move around and see. But when she saw Dr. Diana Sachel and find out that she has external resorption, she was referred to me, but another person could tell her to extract the tooth. Don't ever let your tooth get extracted because they said that you have external root resorption, because now we can take care of that. I've been doing treatments of resorption for 20 years or more, and that was a big part of my PhD research. The topic was root resorption at molecular level. That's what I showed you the first slide at the very beginning. So when you have external, it's because it's outside of the coronal part or outside of the root. If you cannot see it very well visible, then you can take a combined CT scan. What happens when you have this external resorption? Do you extract the tooth? What are you going to do as a patient? Would you like to have an implant? This young patient was depressed, was crying every day. Everybody was worried about her because she didn't know how can she fix her tooth, if she needed a root canal treatment or a crown. But I said, you're not gonna need a crown, so don't worry about it. What we're gonna do is a treatment of root resorption. After we finished the root canal, like it was when she came here, and we finished the root canal, we did her surgery. And as you see here, we put a flap up, the gum up, and then right here is the resorption. We took care of it with the materials I used. We placed MTA before that, a week before when we finished the treatment, and we placed the gel store. After we finished and we suture, then we were able to see the change in the life that we did to this patient. Look at this patient after a year, and then after 4 years follow-up, she is saying that she's gonna come back and the dentist will send me the new x-rays because she's extremely happy. We did an excellent job for a patient versus what do you think if we have extracted the tooth, placed an implant, and this patient is still young and she doesn't want to go to the trouble of having an extraction and an implant because sometimes to match the aesthetic of the patient is very difficult. So the patient is extremely happy. So if you have external resorption, don't panic. It's not cancer. It's the destruction of the calcified tissues of your root or your coronal part due to trauma, of excessive forces, of braces, and you didn't tell your dentist. Not because of the braces, but the force can cause that, and some patients are different, so you have to tell immediately your orthodontist if you're having discomfort. So I always advise to take 400 or 600 milligrams of ibuprofen for 2-3 days, 3 times a day after meals, so the resorption can be controlled a little bit more in case you're gonna have any gene waking up and say, oh, I'm gonna destroy the root of the tooth. So this is not a lecture for the dentist, it's for all the public that wants to know that what do I do if I am told I have external root resorption. Let me know if you have any comment, if you have any questions. You can find my office number at the website, or if you want to set everything in the YouTube channel that you wanted to ask me is complimentary. So if you have any questions, let us know. I hope you liked the episode. Put a like, and we see you on the next Monday with a new episode. Thank you.